Do you have clarity around roles and responsibilities? Can feedback be given in a safe way? Are people aware of what the mission of the company is, what their KPIs are, and are they supported in order to achieve them? All of that stuff is organisational, and that's sort of, I guess, the thing that everybody is part of. I mean, that's the way you create a community rather than a workplace. And then there's what I call the below the waterline, sort of below the tip of the iceberg stuff, which is personal well-being. And personal well-being is that individual's mental health, that individual's social circumstances, and their medical needs and so forth. And I think when you pair the two, an organisationally safe space and a personal well-being tool, you kind of are doing things from both sides, and you're going to have good outcomes. Now, Chris, not to put you on the spot, but you'd be aware, without any identities, of course, being given, you've been the CEO for a while. From a human perspective, what kinds of things has CEO helped Vantage Strata with in the health and wellbeing space? Any individual stories you're aware of?
I've got a couple of really, really salient ones actually, but I'll first address the result of the utilisation that really surprised me. First of all, really, really high utilisation, and we've had plenty of other programs in the past that to be best described as gimmicks. They weren't intended to be gimmicks, but that's kind of how they played. Gym membership and athletes would do discounts and that sort of stuff. And you'd be lucky to get a couple of people that would participate. And often people would go, why aren't people membership of this gym that we've got a program? And people go, I didn't even know about it. And so it goes to show how well it was executed, which is really important, execution. But when we launched CU Health, not only did so many people participate in it, I was embarrassed to see the result of the kinds of services people were accessing so frequently. GP was obviously the highest. That's what I thought it would be. People would save time by going to the GP, and it would save me hours of people being out of the office waiting in the waiting room. Really wasn't the case. GP was high, obviously, but really close second, like neck and neck, was psychological access. And that trend has maintained all the way through, 3 or something years into it. So what they told me was there was an unmet need amongst my team. Whether it was because of their work or their personal circumstances, it sort of doesn't matter. They had an unmet need. If people were showing up with, the broken arm to work, like they need to treat that. And I was embarrassed, frankly, to see how under-supported that need was. A couple of really key examples, of people who have been happy to share with me and their comments to be shared publicly without their identities being revealed. 2 people within my team have said this saved my life, and they didn't mean that metaphorically. They believe that it saved their life, and it was from that psychological treatment access.